Good afternoon and welcome to this hybrid meeting of Social Services Scrutiny Committee on the 11th of December 2025. I am Councillor Charlotte Bolsworthy and I will be chairing this meeting. This meeting will be recorded. Please can you ensure that your phones are switched to silent for the duration of the meeting. When asked to raise your hands, members who are virtually viewing, raise your electronic hand, and members in the room just raise your physical hand. For those members virtually viewing this meeting, if you can keep the chat function for urgent IT issues and not for questions or comments. And I wish to remind members signing in remotely of the legal obligation to have their camera switched on during the meeting, please, in order to be seen and heard while participating in council business. Officers are reminded that they are free to leave the meeting following their item. We are not due to have a fire drill, so should the fire alarm sound during the meeting, please make your way to the nearest exit. For the purpose of the recording, please can we go around the table and introduce yourself, please, for the benefit of the recording.
Let's start. Good afternoon, I'm Pamela Chivers, Democratic Services Officer for this meeting.
Good afternoon all, my name is Andrew Jarrett, I'm the Director of Social Services, Housing and Community Safety.
Shelley Howard, Head of Housing and Communities.
Rob Davis, Principal Officer, Housing and Adaptations.
Angela Thomas, Head of Adult Services.
Sorrel Jones, Principal Officer, Adult Services.
Hayley Shaw, Principal Officer, Commissioning.
Sarah White, Principal Officer, Prevention and Early Intervention.
Good afternoon, Kerry Warren, Head of Children's Services.
Thank you, everyone. I'm going to go straight into agenda item 2, declarations of interest. I personally want to declare declaration of interest for hold on 5B as I'm a PA myself, and also 5C with working in CW. Anyone else? Declaration of interest? I see none. Signature. That's right. Item 3, you'll see the minutes attached at pages 5 to 27 of your agenda pack. If you feel these minutes are accurate record of the meeting, I will propose, can I have a seconder, please? If members do not indicate to the contrary, then I will take it these minutes are approved. Sharon?
Can I just check with members at home if anyone can second?
I can't see Sharon. There's Sharon. Okay, Sharon.
Sorry, I didn't hear that, Chair.
I'm trying to read it out again.
I'll read it out again. I need, right, if you feel these minutes are an accurate record of the meeting, I will propose, can I have a seconder, please? If members do not indicate to the contrary, then I will take that the minutes are approved. Sharon, do you want to propose a second? A second?
Yes, that's fine.
Can you all hear me tidy on that screen? Yeah, that's right. I know in obviously briefing, we did have a bit of a issue with delay, and it was a bit like a sort of a Chinese sort of dubbed video. But yeah, so let me know if there is a problem.
Chair, can I confirm? So did you propose?
I propose.
Councillor Freegard has seconded.
Yeah.
Is there any any indications otherwise? All members approve those minutes.
Yes, they do.
Yeah, those minutes
are all looking happy there.
Yeah, thank you, members. Those minutes are approved.
Right, we go straight on to agenda item 4, from the Cabinet Work Programme. Item 5, this is now the Scrutiny Committee Forward Work Programme, which we've asked to come on to the committee. So you go straight into agenda item 5A, which is the progress report to the monitor of the implementation of new disability grants policies. Again, this is a report for monitoring. There was no questions in pre-brief. I don't know, Rob, if you want to say something, because the only question that we did have, which is obviously on the performance figures you stated, is obviously the time waiting for a grant, obviously now, because there was previously to this longer
Yeah.
then.
Yeah, fine. As you can see, before we implemented the change, we had quite a massive waiting list, a massive waiting time, potentially 2 to 3 years, 400 on the waiting list. Since we brought back the means test, we've completely wiped out the waiting list, and we are now reactive to all DFGs coming in. So as they're coming from the OTs, once they've done their assessment, they send the recommendations across to us, and we deal with them immediately.
Yeah,
So there's no
excellent,
waiting
that
time
is.
at all at the moment.
Yeah,
And
that's
has been for some months since we implemented
yeah,
it.
that's great.
So it's been definitely a success. And in the report, you can see the reasons for cancelling, and the vast majority of them are because of these test contributions.
Yeah, and
So,
that's
that was
a
success.
brilliant service, isn't it? Jimmy? We just sometimes just questions, members? Oh, right, thanks for that. We can go straight down to agenda item 5B, which is the direct
Oh,
payment service.
Chair, sorry, I did have my hands up. If I can,
All right, okay.
if I can make a very brief comment just on, obviously it's a very comprehensive report, and I just like to reiterate sort of appreciation to Scrutiny for taking the step, earlier in the process of supporting the change in our policy and our processes, and reintroducing the means testing. I mean, ideally, of course, we would, all want these services to be universal without means testing. But the reality was that the current situation or the previous situation wasn't sustainable. So I think the report demonstrates really that it's achieving the results that we all hoped would come from the change of policy. So thanks to all members for that, and obviously it will be subject to future reports and monitoring.
Okay, thanks, Al. So I go straight on to agenda 5B, and this is the direct payment service review. Again, this is for information only. So I think it was a straightforward report. And again, I think I'd be interested in now, because obviously this is like the plan that you're showing where you're changing the service and the systems within the service. And obviously, I think what we are going to enjoy is watching, obviously, the impact of the new plan going forward. So I would just like to see that come back in the future, to obviously just like have a look at, the findings then, obviously, of especially the one with obviously like clawback of like say money haven't been spent and things like that. But in pre-briefing, there was actually no questions on that. So again, is there any questions on that? No. So I normally do ask for briefings now, but in fairness, the report is so straightforward, I don't feel there is a need today.
Okay.
Agenda item 5C, domiciliary care. This is quite exactly the same as there, really well information, and it is information only as well. We didn't have any questions in pre-brief. I don't know if any of the members that didn't come to pre-brief got any questions on it. Is there anything that you want to add to this?
Yeah, just one thing, if I could, Chair. I think this has been a comprehensive review, but I think I want to bring to members' attention, putting into context the demographics.
Yeah.
So what the demographics are telling us, that the over 65 population is going to rise significantly in the next 15 years. And within that same time frame, the over 85 age group is likely to double. So this is a major issue for adult social care. And hence we're doing a significant number of reviews that we will bring into your attention over the coming months.
Yeah, that was when I read it, that was a big concern that jumped out of the paper. And again, it's, how are we going to deal with that when it comes? So I'm just glad that you're obviously already looking ahead for that to try and reduce the risk when it does. So excellent for that. And again, I look forward to that coming back at a future date as well. One thing I will say though is that I know that yesterday the first woman went into Tremglin, and the family gave me feedback last night, and they but obviously last night I had a text saying that they were absolutely blown away with the facility, and how amazing the staff were there, because they were very apprehensive of going because it's all like new, and it was really, really pleased with that. Right. Agenda 5B. This report is for decision. This is
Councillor Hayley Davis.
Hayley.
Yeah, thanks, Charlotte. Just one question. Could we have an update on how many people are currently in Clermaclyn, please?
Yeah, there's 4 individuals in the reablement unit.
Oh, that's
And the
lovely. And
main-
it's
Yeah.
great to hear
12
such good
beds.
feedback as well.
Yeah.
Sorry, Chair, back to item 5D, we're on.
Oh, that's one there. Okay, then on. Okay, with 5D, obviously you remember that we did the we set up the social services scrutiny committee task and finish group for the social impact bonds. That didn't get anywhere because we couldn't actually find anyone to basically go through it, or obviously direct us in a certain way in that. So we've had meetings with the heads and the director about looking at focusing on an area of need, which again was dementia. So looking more around residential care for people living with dementia and that. So I don't know, Pam, if you want to obviously come in and explain a bit more.
Yeah, sorry. Yes, just as the Chair explained, the previous social impact bond task and finish group did not progress as we'd hoped, for the reasons that the Chair has just explained. But the members still expressed a wish to carry on with the task and finish group, looking at items that within the transformation programme. And as the Chair said, she's had meetings with Director and Head of Adult Services, and it was suggested that focusing on dementia, looking at the provisions for dementia going forward, would be a good area of focus. So before you today is the draft terms of reference, stating what the task and finish group would hope to achieve. So that is there for members to make a decision whether they approve those draft terms of reference today. And then following that, progress can be made on that in the new year.
Okay.
Yeah.
So again, going forward on this as well, is that we are going to ask for members to put themselves forward on the group. But if you obviously have like work commitments, or you've got other commitments that you can't dedicate your time to this, then not to worry about it, because I prefer it to go out to members outside this committee as well, who have got the time and the interest in it to do it as well. Okay. Carol.
Thanks, Charles. Sorry, Chair. Yeah, I'd like to put my name forward, and I have experience of Alzheimer's and dementia that I think could bring a lot to the group. So I'd like to put my name forward now. Thanks.
Okay, is there any other members that obviously want to have a think about it, or want to obviously say now? Okay, have a think about it and come back. Oh, Dan?
I'm not a member of this committee. I'm a substitute here today, but I'm retired. I've got a lot of time on my hands, and I'm only on one committee. So yes, I'm free to, should you not be able to get anybody from the actual social services committee, then yes, I put myself forward.
Okay, thanks, Dan. We put you down.
Thank you.
Right. So the recommendation is listed on page 64 of the agenda pack. I will propose, can I have a seconder, please? Carol.
Yeah, I can see Councillor Carol Clement-Williams as a hand up. Thank you, Councillor.
Members, please indicate if they wish to abstain.
Chair, I can see no abstentions.
If you do, members, if you do not indicate to the contrary, then I will take that this decision is supported. Thank you.
Chair, I can see no indications to the contrary, so this recommendation is supported. Thank you.
Right, we'll go straight on to agenda item 6, the performance review. I'll just bring Sharon Freegard in.
Oh, thanks, Chair. Yeah, I've just got a couple of questions, Kerry, on page 83, 84 and 85. On page
Sharon, what was the measure again on
it's
them?
measure,
Measure 7,
measure
is it?
5, number of children looked after, yeah.
I know the pages are not on it. So.
On the well, I think we have asked before, and this may have been written before our request, if we could have the actual data and analysis, perhaps some more analysis on the actual data above in the comment box. It might be easier, and we might not need to ask any analytical questions then. I was just on the narrative that is there on the first paragraph. It sounds again like it's a target to reduce the numbers. So, you know, because it says this approach can be evidenced by the reduction of 7 children in care, but I didn't think that that was part of our priorities, that it was more to ensure, as you said in the first line, that every child and young person has an opportunity to grow in a safe and stable environment. But the way that's written there does sound rather like another target to reduce the numbers. So some reassurance there if you can. And on the second paragraph, where there's narrative again, I was just wondering where you say, or where the department says, we ensure that we consider plans and support permanency for children and young people outside of the care system, wherever it's possible to do so. I was just wondering if you could just a little bit expand on that. When you're talking about children, can you say exactly what the approach outside the care system is? Thanks, Kerry.
So two good questions, Councillor Freegard. We don't have targets in that sense, so it wouldn't be another target. There isn't any targets with regards to children looked after. So it's an approach in terms of a social work approach where we recognise the majority of children could and should be living safely at home, and some of those families will need some additional support. But just to reassure you, there isn't any target. We're not sort of working towards reducing the numbers of looked after children in that way. We're simply supporting families and children that are in foster care or in residential care, so that we are able to reduce the risks and build up a family life, so that it makes it easier for children to return home. So I hope that answers the first bit and gives you that reassurance. In regards to the second bit around how do we support children perhaps outside of the system, if we put it that way, it's in exactly the same way as we would support children inside the system. So it's a strength-based model of practice. So just to offer reassurance, we could get better actually at bringing some information, some data to you that shows the number of children that are presented every week in Neath for Talbot where there is a request for accommodation. And I think that would perhaps surprise you. During our recent CIW inspection, a young person was left on the steps of the building, and there was a request for that young person to be looked after just for Christmas. So 99% of those young people don't get anywhere near coming into care, and that is about the way we are supporting families and the social work approach. So we could probably bring something that could describe that with some examples in more detail in terms of what that support looks like for families. And we're very successful at doing that. So that's how the numbers are lower, because the majority of those families that present to us with very real pressures and challenges, with requests for youngsters to come into care, the the level of support and the way in which we're supporting families means that the majority of those children don't actually enter the care system.
Okay with that, Sharon?
Yeah, thank you for that, Kerry. Yeah, that would be good to have that in a separate box and just to keep the commentary box purely on the data above so that we can, you know, drill down on that particular data. So my next questions are on measure 6. On measure 6, which is page 84 on my papers, it says, I was just wondering, of the 35 neglect, or the 12 with a physical abuse, are they in care, or are we monitoring them? And if so, what monitoring is taking place on those particular children? Just wondered if you could let us know that.
Right, so I found, so these are children whose names are subject to child protection registration. Yeah. So could you, because I was looking for it, I wasn't sure which measure you were looking at. Could you repeat that question?
You've got 35 children showing neglect. Yeah. You've got 12 children showing physical abuse. And I was wondering, are any of those particular children in our care? And if not, what kind of monitoring is taking place on those children?
Okay, and that's a really good question. So there will be some children, and you've already touched on this in earlier scrutiny, where you've asked us about children being on the register for a longer period of time, and we've offered reassurance in what we do when we can see that despite being subject to a child protection plan and a multi-agency sort of support plan in terms of keeping those children safe, the risks have remained the same, and sometimes they increase. And they are the cases then that we would look at in more detail, and we would meet with our dedicated children's lawyer to discuss sort of next steps. So, for example, if we've got children that have been on the register a long time, the child protection plan is proving ineffective, then we will look to see, as part of an assessment, whether it's still safe for those children to remain at home. So there will be examples where youngsters have come into care because the risks have remained high despite our intervention. And that's where you'll see on some of the documentation sort of the same information being represented in two different sort of ways. So you'll see them still on the child protection register, so subject to child protection plan, but they'll also be included in our children looked after, because they will become looked after children. And then there's the process is one where we go back into conference and we would be advising a multi-agency partnership that those children are no longer living at home and that they are now in foster care. So an event, and then that would lead to deregistration for those children. And you asked, the second part of that question was reassurances around. If you could remind me what the second part was.
Well, what monitoring? If I was wondering if they were included in the 222 that you actually had on in the LAC.
Yeah. So
and again, if that data was in the commentary below, I wouldn't have asked that. But I just wondered how many of those figures there showing in that column were actually LAC children. And if they're not, when we're talking about the neglect, because there's 35, was the process of monitoring quite regular?
Yeah. So if I start with that point first, so there is rigorous monitoring of children that are subject to child protection plans, and that's multi-agency. So a minimum standard from us in Children's Services would be a physical visit. And you'll see things, there's no doubt that things that happen over Christmas. Every year you'll see, awful stories, tragedies on the news, and I've no doubt it'll happen again this year across the UK, where children will be seriously injured or killed. And so it's really important for us to make sure that we get that right, in that there is a quality to the visit. So we will see children in their own home, we see them on their own, we'll see them in school, we'll see them outside of the family home in other environments, and give them genuine opportunities to tell us and talk to us about anything that might be of concern. That visit is at a minimum of every other week, and it's usually in conjunction with other partners visiting as well. So that could be a health visitor that would be visiting in between. Obviously, the lifeline is for school-age children is the school, and so that multi-agency partnership, that core group of professionals around that child and that family, come under rigorous scrutiny of our own when children are subject to child protection planning. So that would be the case for the children that you've just mentioned. But you've made an interesting point about, could any of these children be looked after children? And as I said earlier, it would be if they've been subject to a child protection plan for a long time. There's either been a particular concern all over that period of time, despite that level of work going on and assessment, we haven't made the difference. We haven't reduced the risk. And some of those children would come into care, they'd become looked after children. So as I said, we can provide some information to you that would show, it's very low numbers, but it would show the number of children that are subject to child protection plans and they are looked after children. Because it would just be a short period of time before we went back into conference, because those children, for the most part, would need to continue to be subject to child protection planning, because they would be living in foster care, essentially. So we can provide a little bit more information about that for you, Councillor, if that's helpful.
Okay,
Sharon, do you want to come back?
yeah, thanks, Kerry. It was the timing every other week. And obviously, if you didn't see that visit, I would presume that it would be the following week. Would that be the case if you didn't get to see them?
So it's, and they're good questions. That's a minimum standard. The reality is, and I think you'll see this with, it's been a point mentioned in our inspection, which was last week, where the inspectors recognised that our level of visiting and monitoring of children on the Child Protection Register far exceeded our minimum requirement. So it was, social workers are there, several times a week, in all honesty, but the minimum requirement is every other.
Oh, thank you, Kerry. That's really reassuring. That leads me on to my last question, which you sort of answered. On the page 85 about the number of children receiving care and support, we got 655 on that list, 221 in care. So the other children, or is the 221 included in that? Obviously, we're closely monitoring them. It seems an awful lot of children to closely monitor. And so that was one question. How does that work? Briefly, if you could give us that briefly. And what arrangements are in place over the Christmas period during heightened times, which you just related to?
Okay, so the first one is that it is the number of looked after children plus the number of children in need of care and support. And you are right. That's a lot of children, and obviously we support unaccompanied asylum-seeking youngsters on top, and we have a foster and adoption service. So it's a large number of children within Neath Talbot that we are supporting. Very, very briefly, and again, you'll see this in the inspection, the report that will come to you now in the new year. They do talk about how well organised and how experienced the staff are in the whole service, so that they are confident in terms of how children and families are being supported, whether it's the lightest touch to right the way through to children and families that are in court proceedings. So I think that's something that's been recognised in terms of, yes, we are supporting a large number of children, but I think, you know, it's we do that very well. You know, the workforce manage that very well in challenging circumstances. You've just asked a question that I always ask about a month ago, which is right, you know, let's how well prepared are we for Christmas? And I'm pleased you've asked that question, Councillor, because Christmas for Children's Services is a very different Christmas, and it's the hardest time of the year. So we have already organised ourselves so that we have a good support network right the way through, and that's the daytime and the nighttime, because obviously we've got our out of hours team as well. So we will have looked at every single child that we are supporting, either on a child in need basis or on a child protection basis, to ensure that that plan is as it should be, and that every child will be visited and supported throughout the Christmas period. So we'll have seen everybody before Christmas. We have a team in work over the Christmas holidays, and as I say, that includes obviously the night time because of EDT, and we will regroup in the middle of the Christmas holidays to make sure that, you know, things are going okay, and if anything has come up that is unexpected, which you will, then we have the resources to manage, and then we regroup early in the new year, straight after sort of when we come back to do the same thing again. So, and I know that sounds, you know, but that is the level of that's the priority, I suppose, that you know, is given to kids during holiday times, because the risks are so high. So, you know, it's a very pressurised time for families, and things happen during the Christmas holidays. So thank you for that, question. We have groups of support staff that will be working alongside social workers and managers and ourselves right the way through the Christmas fortnight.
Right, is that Sharon, yeah?
Yeah, thanks for that, Kerry. It's reassuring to know that that's in place over this heightened time. Thank you.
Sharon?
Thanks, Chair. Thanks for all the great questions. I believe that having you can look at it two ways. We don't want to be not taking children in the care and leaving them in danger. However, it should be a goal for us to reduce the amount of looked after children, because basically at the end of the day, if we can do that safely, the best place for them is in the home with their families, as long as they're functional and you know, they're safe and being looked after properly. It's a win-win for everyone, because our costs for one looked after child are enormous. So I know when I first became a councillor, we were in special measures and we got out of it so quickly, and being held up for best practice throughout Wales for our figures declining when everyone else's were rising. So I know we have a lot of experience there. I'm sorry I'm talking like this because I'm quite new to this committee, as you say, and I'm not really sure what's gone before. But I do think it's a good thing to aspire to, as long as it's done for the right reasons and in the right way. I think that Team Around the Family is worth the investment. Is that still the case? Are we still held as throughout Wales as being best practice? And if not, why not, and what can we do to improve? Thanks.
Thank you for that, Councillor. In terms of Team Around the Family service, I think it's a piece of note that it's expanded. So it's done so well that we've actually added more staff to Team Around the Family, because the demand has increased so much, and they achieved really good outcomes. As I said, we'll be bringing the recent Care Inspectorate Wales inspection. The report that we went through the inspection last week, and I think you will be pleased. There's a number of good sort of points that they raise, having inspected children's services last week. And they've actually, one of the things that they said is that they are recognising the whole service as a model of good practice. So I think that's something that Neath Talbot, should be proud of.
Okay, Carol, with that?
Yeah, I think it's excellent, brilliant work, well done. But I'd like to wish you all a very, very Merry Christmas in social services. You know, it's tough for some of the things that we do in social services, and our staff are so dedicated. Hats off to them. So thank you. And if you can thank the staff for me for all the hard work they've done during the year. Thank you.
Okay, thank you, Carol. Right, let's go straight on to agenda. Oh, sorry, Sharon, I didn't see you.
Yeah, I just wanted to say to Kate, I forgot to say I'm really looking forward to reading the inspection report. And I'm sure there'll be a well done. But just to affirm the statement that obviously Kerry has reiterated that it's always the child that is the priority, and we don't bring cost or target into anything we do. And I'm sure that's gone towards the good model that we're presenting. Thanks, Kerry.
Here comes that.
Sue Grimes, please.
Oh, thanks, Chair. Just a question really, Kerry, and it's lovely to see you again. It's just on the measurement, measure 6, children on the Child Protection Register. It's just an observation of mine. You've sort of itemised about emotional abuse, how many children are on that, and neglect, and all of them are there. But right on the bottom, where neglect, physical and emotional abuse comes into that box, it's 0. Now, I would have thought that neglect would cover emotional abuse and basic physical abuse in some cases. So would it be better to add the children together in that box? Because that's the amount of work you're doing as well.
And it's lovely to see you as well. That's a really good question. That's more about how Welsh Government count things. So they've obviously done a piece of work and looked at how they are counting, categories, if you like, the abuse. You'll have seen over the years, so that will have changed a number of times. And I suppose when there are cases where there's certain situations where all of those areas will be right up there in terms of how children have been hurt. Yes, and there will be, occasions when we would be able to make that argument in terms of children suffering or likely to suffer. All of those categories, would meet the criteria of all of those categories of abuse. But, I understand what you're saying, and I think it's more about how that data is being collated, because as you can see, the numbers are usually, as you just described, there is 1 or 2, and as you say, in terms of neglect, sort of prevalent, sort of the in terms of child being hurt, it's more often the case where there is 1 or 2 areas where you can see they've been hurt in that particular way. But this is more about capturing that, because that's what we've that's what we've been asked to do, and that would be the same across Wales.
Okay, thanks, Kerry. Thank you.
Okay, Shan, is there a question? Yeah.
No, I just wanted to really quickly say Kerry's been a bit modest there when she's saying good. The inspection was actually outstanding, so I look forward to you all reading it as well. So well done, guys.
Okay. Right, great, thanks. Right, agenda item 7. I'm going to pass over to Pamela to see if there are any updates are added and changes to the forward work programme.
Good afternoon, members. Just to go through some changes to the Scrutiny Committee forward work programme. You've had sight of the Cabinet and Scrutiny forward work programmes in the agenda pack. So you will notice that for today's meeting, the Social Services Director's annual report has been removed. That will now come to scrutiny on the 22nd of January. And the unpaid carers report has been removed from today's meeting and will be considered on the 5th of March. Regarding the 5th of March meeting, these have all been in consultation with the chair. 3 reports have been removed and they will be reprogrammed into the committee cycle. The first one is the Healthy Relationships and Stronger Communities 2025 Progress Report. The update report on Safer Communities Strategic Intent and the permission to tender for emergency accommodation for women. So they will be reprogrammed in our next cycle of meetings. The following reports have been added to the follow programme for the 5th of March. And these are Eliminating Profit Update Report, Children's Services Review 2025 Report, and an update on the West Glamorgan Shared Lives. So unless members got anything else that they want to bring forward on the follow programme, I'll hand back to the chair.
Right, well, agenda item 8. I have no urgent items, so now's the time of the meeting that I wish you all a very Merry Christmas, Happy New Year, enjoy yourself, and have a good time. Meeting is closed.
Thank you.
Thank you.
Merry Christmas. Bye-bye.
Thank you. Merry Christmas, everybody. Bye.
Merry Christmas.